Hi, Seth. How are you doing?
Oh, good, yeah. Good.
That's good. What are we doing for you today?
Oh, I just feel a bit tired. Just want to freshen up
Okay.
the face.
Any areas of concern that you think you have that you may want me to address?
Oh, just the cheeks and the chin a bit.
Okay. Are you concerned about the
Yeah.
nasolabial folds that are
Yes, I
forming?
am. Yep.
Okay. And what about the shape of your brows? Do you think there's anything that bothers you about them, or you think they're sagging a bit over the last few years?
Yeah, a little bit. Maybe we could look at that too. Yeah.
Okay, all right. So there are a couple of things that we can do to address this, your concerns. But first, let's see the areas that we think that you need addressing. So I personally think that, like any person, as we get into our 30s and 40s and 50s, there are two sort of phenomena happening. One is that we get fine lines and wrinkles, and the other thing is that we start getting sort of volume loss in our face. So volume loss is soft tissue as well as the bone remodeling. So that's very, very obvious, especially in the mid-face area. So the cheekbones that are here, that are supporting and are more convex, what they tend to do, they redraw and go back. So the soft tissue above them tend to sag down. So if I were to have a look at you, so this is the sort of a sulcus is here that extends from like that. And this, if you put your finger here and here, you'll feel that there's a sulcus here which is dividing your cheek into two regions. That's happening because the bone underneath, the zygomatic bone, has remodeled and atrophied, gone back, and the soft tissues and the ligaments and the fat pad, the malar fat pad that was sitting there, has come down. So since it's coming down, it's now contributing to your nasolabial folds, which are here and here. So now, to address this, there are a couple of options that we have. So we can put a dermal filler, like hyaluronic acid fillers, deep right on the bone, and to create that concavity. And then, if we want to address the nasolabial fold like this, then I would be inclined of doing some procedure that can actually lift it up like that. So
That sounds good.
this sort of thing. So I would be inclined in using Promoitalia threads. So if we gonna go up here, and the other one, and then suspend it from up there. So these two procedures combined together would give you a really good result. So not only are we lifting your mid-face up like that, then the hollowness that is still left there after we have lifted, we can address that with the filler injected right in this triangle, deeper on the bone. The threads are not only gonna keep it up like that, they're gonna create a fibrotic response and collagen stimulation. So that would fill up this area, and the bone remodeling and resorption, we're gonna address it with a hyaluronic acid filler. So same thing if we do this over here. So again, I would like to treat this area with a filler and then lift the nasolabial fold like that. And then we come to your brow. So ideally in a female, the lateral brow, this portion, should be sitting higher than the medial brow. In men it's usually on the same line on the orbital, supraorbital rim, but in female the ideal position is like a seagull wing. It's like up like that. And again, with age we lose the supraorbital fat pad and bone remodeling, and that's what tends to sag it down. So a bit of Botox along here and here to smooth the muscle, the orbicularis oculi muscle that tends to pucker our eyes like that when you smile. Can you smile for me? See? So this is going down. So we smooth this with the Botox to open the angle, and then we can put some filler here and here to address the volume loss in the lateral brow, to lift it up. Now the choice of filler can be, we can use a collagen stimulating filler like Sculptra or Radius, or we can use a simple hyaluronic acid filler there as well. For you that would be sufficient, but for someone who's got more obvious brow ptosis, then we have to address that with Promoitalia threads again, and that way we have to anchor, put the threads starting from up here in this manner, so that to suspend it up like that. So that's something that we can do as well if we think that Botox and the filler on their own are not doing the job correctly. Okay?
So Dr. Hassan, you were saying that using the combination is
Yeah.
really a good way to go.
Exactly. We cannot address any facial concern just by one treatment. It has to be different treatment working together in conjunction. Just like any diet program or acne treatment program or any other sort of program that needs more than one treatment modality. So we find that Promoitalia threads, that are the latest threads available in the market, which are absorbable threads, they work fantastic in conjunction with treatment like fillers and Botox in addressing and giving a three-dimensional improvement in the overall volume loss and revolumization.
So any patient that is interested, you're situated in Perth, aren't you?
Yes, I am.
So what is your name of your clinic?
I work at Bioscore International. We
Yes.
are located on 190 Hay Street, and it's in East Perth, so just toward the Wacka end of East Perth.
Great. And so you would actually encourage people to come and have a consultation and organise a program for them, is that right?
Definitely. We offer all sort of medical procedures, minimally invasive. So our dermal therapist can have an initial consult with them, but if required, I can have a consult with them to address and to come up with a treatment plan over a period of time. So instead of offering one-off treatment, I tend to encourage my patients to look into an overall rejuvenation package where we work together as a team to address their concerns over a period of time.
It's like a mini makeover.
Mini makeover, exactly. And it
Fantastic.
also depends upon the budget that they have,
Yes.
how much they can spend, how
Yes.
much they're comfortable with spending, and how much improvement they want or I think that they need.
Fantastic. Well, it's been lovely talking to you, and
Thank you.
Thank you very much.
Thanks a lot.